of that, now we're looking, the next section is on patient involvement in brain health. So we have Jaarsma, has been working with the European Federation of Neurological Associations since 2012 and began her position as president in 2017. So being a patient herself, she is passionate about health from the patient perspective, and in particular in the field of neurology and about patient-centered care and research. In her professional life, she worked in scientific publishing for many years, and after retirement, decided to dedicate her time to patient advocacy in the brain space. So her work at EFNA concentrates on topics that add value to the work of the disease-specific patient groups that are members of EFNA. So it's also a member of the Executive Committee of the European Brain Council. So you're very welcome and thank you. Look forward to your contribution.
Thank you, Deirdre, for this nice introduction. Good afternoon, everybody. I am really pleased to be able to represent the patient voice at this important meeting. So let me start by saying, and indeed, that I'm president of EFNA. And EFNA is, as you see here, the European Federation of Neurological Associations. And we bring together disease-specific patient groups, pan-European, in the brain field, in the neurological field, I should say. Our vision is to work towards a better quality of life for our patients. And we do this by talking to the policymakers, as we are doing today as well, by communicating with our members, and the idea is that we add value to the work of the disease-specific groups. So if we work together with Alzheimer Europe, we are not duplicating their work, we're trying to add value to that. And also we work very much on strong partnerships with the stakeholders in the brain space. And our main partners in this space are the European Brain Council. As Deirdre mentioned, I'm on the executive committee there, and the European Academy of Neurology, with whom we work together closely and have a memorandum of understanding. So this is a picture of our membership. At this moment, we have 20 member groups within neurology. As you see, these range from the well-known ones, such as epilepsy, Parkinson's disease, MS, the diseases most of you will know, but also many of the less well-known groups, such as Huntington's disease or dystonia or restless leg syndrome. Our work focuses on these three pillars. I'm sure you find a lot of similarity with what Alzheimer Europe are doing. So advocacy, collaboration and empowerment. We work a lot on empowering the patient community that we represent, and we do this through our training initiatives for advocates and also through the e-learning modules on our website, which I recommend to everybody to have a look at. They are very informative and high level. Coordination and collaboration with the brain health community. I think me being here today is a good example of how we collaborate, for example, with Alzheimer Europe. And awareness and advocacy are the main pillar of our work at this moment. And we have initiated a major project in the past year called One Neurology, and I'll be talking about that a little more later on. So let's talk about brain health. As Dr. Behrens already said, the exact definition, by the way, of brain health is still work in progress, I would say, but this does not apply to involvement of patients. So over the last decade, it has become clear that patient involvement, such as working with the clinical research community, can help improve research outcomes and endpoints for both patients and caregivers. And there is evidence that this will help ensure that research is focused and acceptable, starting with asking the right research questions and creating appropriately designed clinical trials, and then right through to HTA, health technology assessment. But in more basic research initiatives, it starts with developing a shared research agenda, and it ends at better evaluation of these research projects and their impact on patients. We may say that patient involvement not only has the potential to reduce the considerable amount of time that research takes, it can also improve the efficiency of research, ensure better enrollment in clinical trials, better adherence to therapies. It can even be an important driver of innovation by supporting the researchers in asking the right questions. We all know that this is something that is missing in many cases, and that is all about what matters most to those affected by a specific condition. So it is clear here that there needs to be a good relationship between patients, between policymakers, between academia and industry, the overall condition. There is a need for all clinical studies to include patient-reported outcomes and patient-reported experiences, what really matters to patients while coping with their disease. But it also raises the point that, for example, regulators and payers are open to accepting patient-reported outcomes and welcoming the opportunities provided, for example, by the digital transformation of healthcare. And of course, there's a need for research funders to be on board here. There are many challenges. This was mentioned before as well. What are they? I have tried to capture them in this slide, but I'll go into these a little bit one by one. The specificity of many brain conditions, and mind you, I'm not talking about just neurology here, I'm talking about brain health, so neurology and mental health. The specificity of many brain conditions means that the numbers of patients willing and able to participate in research, including in clinical trials, are often limited. Patient populations are dispersed, sometimes low in numbers, and people may experience rapid cognitive decline, as you all know, or may not have long survival rates, as for example in brain tumor patients. So developing relationships with people with these conditions and their caregivers can be challenging and needs careful management, very important. But generally speaking, the pool of engaged and empowered patients and caregivers is growing and eager to get involved in a meaningful manner. Because the thing is, for patients in the brain space, finding a cure for most diseases is unfortunately still a dream. And current treatments, if they exist at all, are suboptimal in many cases. So our community has an added incentive to become involved in research. We are waiting for the breakthroughs and for better patient outcomes. Then about training of the expert patients, as Dr. Behrens also referred to, I think. It is important that also researchers understand the value of investing in patient involvement. Far too often patient advocates are mistakenly perceived as too emotional, not representative, too influenced by industry, or not sufficiently knowledgeable. These misconceptions are not helpful in breaking down barriers. It is important to identify specifically what patient input is required within research to ensure that the right person can provide the right input. Also, how do we ensure there is patient representation on a geographic and cultural level? The international language is English. How do we overcome the language barrier for many of our patients? But there's much more. Digitalization, also referred to, for speech-impeded patients is very important, or replacing face-to-face meeting, also for many of our patients, very important. So also, for example, there is a role here for hardware and software providers in best meeting their customers' needs. For many of our patients, this really is an issue. But in the end, and I again emphasize what Dr. Behrens also said, we need a pool of expert patients who can engage in various research and development activities. And this may take the form of an online platform where good practice, involvement opportunities, etc. could be listed. Let's move on. What is happening out there? In addition to what we have heard from the previous speakers, there's a lot happening. These are just a few examples in the neurology space. RNet neuron was mentioned, JPND, UPATI, Paradigm was mentioned, and the Uritis summer schools are very important. Patient organizations are taking an important role here as well. But the point is, what is the impact of all that? A lot of work, but what is the impact? And this is what we asked ourselves in a recent, very recent meeting between Alzheimer Europe, EFNA, and GAMIAN, the Global Alliance for Mental Health. And this has been a unique event which took place on the 12th of May recently. And the three leading European patient groups, as I mentioned, in the Brain Health joined forces and organized the meeting that you see displayed here. The key message was that brain health, or rather the future of brain health, needs to be safeguarded for the sake of the patient community in particular. And so the United Patient Voice, representing brain health, launched a call to action, and I'm very pleased to share that call to action with you today. Our call to action asks for early engagement in patient involvement processes which are transparent. And this means well-defined, transparent processes that are systematically embedded and ingrained in how you conduct your work streams. Regardless of who you are, what you are, or where you are working, it applies to all stakeholders who play a role across all sectors of, as you see here, research and development, approvals and reimbursement, delivery of treatment and care pathways. And this does not exclude governments. They play a role here too. They support people affected by brain health disorders. And how important this is, and this is a picture about the brain space. In 2017, brain disorders have been reported to cause this is on an annual basis, 1.2 million premature deaths, 24.3% of those associated with non-communicable diseases. And brain disorders have accounted for 34.6 million disability-adjusted life years, almost 27% of those with NCDs. And therefore, I dare say, and this is not only me, obviously, that brain disorders constitute the most prevalent, disabling and burdensome disease area among NCDs in the European population. This is very, very important. And in particular, if we then look at the burden, this is an enormous burden. 1 in 3 Europeans are affected by brain disorders. And this is getting closer to 1 in 2. And these are very recent and rather shocking figures. 2/3 of people receive absolutely no treatment. 2/3, and yet 295 billion is spent directly on healthcare, and the total cost, economic cost of brain disorders is some 800 billion per year and growing with the aging population. So no matter who you are or where you are, this will affect you directly in your family, your friends, your colleagues, your neighbors. Nobody is removed from this discussion. So let us stop wasting money, let us stop wasting time and expedite the benefit to people by involving people living with brain disorders and those who care for them, because they are the true experts of their conditions and their lived experience. We need to ensure that patient involvement processes support that what is developed is fit for purpose. We need to ensure processes are meaningful and lead to shared decision making. And this means that we want to see evidence of the impact of patient involvement, so that it is not just a tick the box exercise or lip service to the patient population because patient involvement is trending. Let us make sure that involvement processes are respectful of the time and resources of those involved, because remember again that there is an added effort for people taking part in these processes as compared to the general population. Then what about involvement? Involvement is distinct, and this can lead to confusion, especially if you look at these three words: participation, engagement, involvement. Because in my view, when you say participation, this often does not mean involvement, but it rather means simply taking part by patients, for example, in clinical trials. Engagement then comes a little step closer. There is a dialogue, but in the end, there's no influence. And this does not lead to any decision making. We are asking for true involvement, actions that are with or by patients rather than for or about them. In such situation, thank you, communication flows are in two directions, and involvement will lead to influence and outcome. So what are the actionable areas? And I've put that here: United, the patient voice of brain in Europe, brain health, calls on national and EU governing bodies to develop and where developed implement policies to ensure early and meaningful engagement to support involvement of patients across all sectors involved in brain health. And specifically, we are looking at promoting human rights-based approach in all policies and research affecting people living with brain health conditions. We are looking at prioritizing patient needs in setting the research agenda. We are looking at reviewing the funding proposals for research. We are looking at access, review, and report on access to diagnosis, therapeutic intervention, and care pathways, on supporting access to and design of clinical trials, approval processes for therapeutic intervention, contribute with industry to patient-centric design in research development and commercialization, and on to optimizing data sharing for patients and society. So again, what is my take-home message today from all this? What does it really mean? It means there needs to be well-defined, transparent processes that are systematically embedded and ingrained in how you conduct your work streams. And this applies to all stakeholders who play a role across all sectors of, again, R&D, approvals and reimbursement, delivery and treatment and care pathways, and governments to support what's happening now. Are you tired? Okay. But anyway, this was almost the end of my talk. So what I've tried to say, patient involvement is not just a matter of patients, but rather of the multiple opportunities which are there, from health technology assessment, to policy, to personalized care, to co-designed treatment and decision making. In all of this, the patient can give a meaningful, if not creative, input. Thank you very much.